Okay, good afternoon, everyone, and welcome to our virtual open day. Thanks to all of you for taking the time to listen to what we have on offer this afternoon. My name is Dr. Ian Morris. I am the Programmes Director for the Neonatal Medicine Postgraduate Diploma and MSc courses. And I'm also a full-time consultant neonatologist working at the University Hospital of Wales, which is the regional intensive care unit for Wales and one of the larger UK neonatal centres. So I hope over the next 20 minutes or so, I can use both of those roles to give you an overview of what we have to offer with this course and how we can help you with your career development. So who is this course aimed at? Well, really, we think we have something to offer to many healthcare professionals working in neonatal medicine who are looking to develop either their academic or clinical expertise and further their careers. We appeal to doctors at various stages of their training. So, for example, in the UK system, paediatricians maybe at SHO or registrar level who are looking to enter into subspecialty neonatal training, or more senior registrars who are undertaking neonatal grid training, or perhaps they're looking for SPIN accreditation, or even post-CCT paediatric consultants looking to develop an area of special interest or just improve their knowledge base. Historically as well, on our course, we've had a number of doctors from outside of the UK, so from Europe, from Africa, from Asia, again at various stages of their careers, but who are looking to improve their knowledge and understanding of advanced neonatal medicine whilst gaining a qualification from what is a leading Russell Group UK university. I've also been really pleased to have nursing professionals undertake our course, and I'd particularly recommend our programme to nurse educators and advanced neonatal nurse practitioners. However, I'd also encourage any nurse who's qualified in speciality to consider whether this course could help with their professional development. Previously, we've had a neonatal pharmacist on the course, and more recently, we've had interest from physician associates. So I think really there is a broad appeal across the neonatal healthcare setting. As a busy full-time neonatologist myself, I really do understand the difficulties of undertaking extra work, particularly as many of you listening into this will be working shift patterns and very busy clinical commitments. So for that reason, we've tailored the course to fit around your learning needs and clinical commitments. The course is delivered 100% online in a distance learning format. Each of the modules are fixed over 10-week blocks, but there's flexibility within those blocks to study at your own pace and at a time that suits you. So what are our course aims? Now, no doubt each of you will have your own reasons for wanting to study on this course, be it an academic interest or to gain an extra qualification to help further your career, or simply to increase your knowledge and understanding of neonatology. But I'm sure and hope that many of you will share my key aim, and that's simply to help you achieve better outcomes for your patients and their families. So with that in mind, each of our modules is really very clinically focused and will incorporate key aspects of fetal growth and development and the pathophysiology of health and disease in the newborn. And we'll deliver that content using evidence-based approach, which will utilize the latest research and developments in what is, I'm sure we all agree, a rapidly evolving speciality. We'll also take time to consider and reflect on the ethical challenges that clinicians face every day in what's a unique area of medicine. For me, one of the major selling points of our course is our faculty. I'm privileged to have working for me module leads who are all full-time consultant neonatologists based either in level 3 UK neonatal units or major international centres, all of whom have additional expertise in education and/or neonatal research. In addition to this, we're really lucky to have video lecture and discussion board contributions within the modules from a range of international experts. So what about the course structure then? Well, the full course is run over 3 years, but there are a number of options, hopefully to fit in with the flexibility that you need. So in year 1, students will study 3 modules each of them and worth 20 credits. At the end of this year, successful students will have the option to exit with a postgraduate certificate or move on to year 2, where in year 2 again, students will undertake 3 20-credit 10-week modules. At this point, students will have the option to exit with a postgraduate diploma, or if they want, they can continue on to a master's or MSc stage of the programme based on their performance over the first 2 years. In this final year, students will write a 20,000-word dissertation in a topic of their choosing. In addition, it's worth noting that all of our modules are available as standalone components for those who wish to study just a specific area of neonatal medicine. So, for example, if you've got a particular desire to study neonatal neurology, you can pop into our course just at that stage and just pay for and learn from that one module. So what are our modules? Well, in year 1, we kick off with respiratory care and neonatal medicine before moving on to cardiovascular care and then finishing with critical care in neonates. In the second year of the course, we start with neurological care before going on to look at nutrition and gut function, which also includes common neonatal surgical conditions. And then we finish with transportation of neonates and children. Each of our online modules will include clear learning outcomes so you know exactly what's expected from you and what you can hope to learn during the module. The next few slides will include a few screenshots so you can get a bit of a picture of how that content will look. We include a very comprehensive reading list, which with full, easy access to all materials through our virtual learning platform. Throughout the modules, you'll have support from the faculty and myself via discussion board forums, as well as having the opportunity to learn from and support each other. Of course, assessments are a part of the programme, but they comprise a range of formative tasks such as MCQs and case discussions to help cement your learning, as well as summative components which are tailored to help you develop a sound academic understanding and writing style. So I've taken a few screenshots here. So this is taken from the respiratory care module, for example, and you can see your landing page will have a clear outline of what the module involves, what your learning outcomes are, and how that module is going to be delivered. On the left, you'll see the various tabs that we have, which will include access to all of the learning materials for the whole 10 weeks of the module, which again will help you work at the pace that fits you. So if you're on a week of nights and you can't get any work done, fair enough. You know, perhaps the next week you can pick up a week extra to sort of catch up. That's also where you'll access your reading list, which will be regularly updated, and get all of the information about your assessments. The assessments themselves will be really clearly laid out for each module, talking you through what's expected of you. And as I've said previously, that will include some formative tasks which don't count towards your overall mark, but which will help you cement your knowledge and practice some MCQs and get to know that the areas better. There'll then be summative tasks which will count towards your final marks, but again, it'll be done in a range of ways which will help cement that knowledge. It will include things like case reports, personal reflections, case-based discussions, and academic writing. And this is a screenshot of a typical lecture week. So for example, this is week 9 of the neurology module, which has a video lecture on imaging and monitoring of the newborn brain. And there'll be clear aims and objectives set out for each of the lecture weeks, along with access to essential reading lists, as well as some further reading for those who want to read in even more depth that particular area. So the next few slides show the headline contents for each of our modules. Each module incorporates a mixture of recorded lectures, written materials, quizzes, and structured assignments. You will be expected to contribute to the discussion board forums, and in return, your module leads and their colleagues and myself will share with you our knowledge and experiences using case examples and evidence-based practice. And it's also an opportunity for you to share your examples and your experience so we can all learn from each other. So we'll start with module 1, which is respiratory care. And as you can see, we'll start by looking at things like lung development and lung physiology before coming on to common pathologies, non-invasive and invasive ventilation strategies, including all common modalities, including high frequency, before going on to look at long-term respiratory problems such as chronic lung disease. In our cardiovascular module, we'll include weeks on basic and advanced physiology, as well as looking at congenital heart disease and specific conditions such as PDA, pulmonary hypertension, arrhythmias, and much more. We finish year one with our critical care module, and this is an excellent module giving a fantastic overview of some of the most important aspects of neonatal care. So working through ethical and communication challenges around extreme preterm labour, looking at delivery room management and resuscitation, and will help you develop a best practice approach to fluid and nutrition management, sepsis prevention, and concepts such as family-centred care, which is becoming increasingly important, particularly in Western healthcare settings. In year two, we begin with our neurology module, which includes some excellent video lectures from some world leaders in brain development and neuroprotective strategies. We'll cover key areas such as intraventricular hemorrhage, white matter injury, HIE, and seizures. And we've also got some really useful material on CFM and cranial ultrasound interpretation. Our gut function module includes in-depth material on the prevention, medical and surgical management of necrotizing enterocolitis, as well as giving an advanced understanding of parenteral nutrition and optimizing growth. We'll also look at some specific conditions such as hypoglycemia, growth restriction, and gastroesophageal reflux. Year two ends with a really interesting module focusing on the stabilisation and transfer of sick neonates, including those with extreme prematurity, neurological conditions requiring, for example, cooling, and surgical conditions, including the stabilisation and transfer of conditions such as diaphragmatic hernia, esophageal atresias, and neural tube defects. For those wanting to complete the full master's level course, year three gives you the opportunity to explore in depth an area of interest to you. Previous examples have included looking at intraventricular hemorrhage, monitoring within neonatal healthcare settings, the best approaches to lung protection strategies, preventing infection in low resource settings. Really, it's up to you. It can be based on something that you're interested in your own place of work. It could be something that's become of interest to you as you've moved through the course. And to do that, you'll undertake an extended literature review, or perhaps a piece of research, audit, or quality improvement in your chosen area. And throughout the whole of that dissertation year, you'll be fully supported with one-to-one support from a personal academic tutor who works in the neonatal field. So, to summarise, we feel this is a course that should appeal to all who work in neonatal medicine. We're offering a high-quality, evidence-based learning experience that's delivered by experts and delivered flexibly and 100% online to fit around busy schedules. We're offering what really is a unique course. There are very few opportunities to study neonatal medicine at this advanced level in the Western world. So I really do hope to have some of you come and study with us, and I'd encourage you to get in touch for further information. But for now, I thank you all very much for listening, and I would be